So oftentimes we have patients come in the office and they say, hey doc, I feel great, I don't have any pain, do I really need to be adjusted? And then we take x-rays of them and we can see arthritis already forming, we can see degeneration already happening, so it's just inevitable when they're gonna have pain. So what we do in the office is we check every vertebrae when you come in and make sure everything's moving correctly so that you don't have the pain or you don't have those symptoms. But just because you don't have pain doesn't mean that there's not already a problem brewing. We have plenty of patients that come in with no pain that develop heart disease, that develop diabetes, that develop liver disease because they didn't have any pain. They thought they were feeling fine, right? But if we would have got them adjusted, we can get that organ functioning better and have better communication from the brain down the spinal cord to that organ, they're better off down the road. So many people don't know this, but only 6% of the nerves in your body feel pain. Those are the ones in the periphery, like your fingers, so you don't cut it, or your toe, so you don't stub it. But a lot of these nerves on the inside, they don't actually feel the pain, right? So that's what we as chiropractors do. We go down through here and check all those nerves and make sure they're unpinched so that every organ, cell, and tissue can function like it should. So if you're already feeling pain or you're already having symptoms, that means your nerve has already been smashed and been smashed pretty good because the pain fibers come from the center of the nerve. So the pain is actually the last thing to show up and the first thing to leave. So patients feel better and they think, hey, my pain is gone, I feel better, I don't need to get adjusted anymore. But really, we need to maintain that spine so that pressure on that nerve doesn't come back. And so as chiropractors, we want your body to function as it's optimal, right? And so that means we've got to make sure the brain has proper communication down the spinal cord, out every nerve to every organ, cell, and tissue. And that's what we as chiropractors do. When we come in, we're checking each bone, each segment to make sure that they're moving, functioning correctly for you.